right, so here we have a right clavicle. It's got a acromial end in green and a sternal end in blue. And this blue and green is on the superior surface. I haven't marked it all the way around. It can be kind of difficult to know what you're looking at. So if you see this green and blue, that's telling you superior surface. If you actually hold a clavicle in your hand, you'll also see that the superior surface is a lot more smooth and the inferior surface is rougher. This acromial end is a lot more flat, and the sternal end is a lot more round. I mean, it is flat on its facet, but as a whole, it just looks rounder, whereas this is flatter, especially in the horizontal plane. Now, if you wanted to tell if this is a right or left, the best way to do that is to find the conoid tubercle, which is facing posteriorly and inferiorly. So finding this tubercle, which is just this little outgrowth of bone here, putting that posterior inferiorly, and now you have yourself oriented. You know that this acromial end is lateral, sternal end is medial, and then boom, you know that this is a right clavicle. The one thing that can help with a double check is that you should know that this anterior surface is convex medially and concave laterally. And you can actually palpate this on yourself and feel that the clavicle sticks out more anteriorly in the medial aspect and like pokes in on the lateral aspect right here. Some other structures that get mentioned is this trapezoid line. It's quite difficult to see, but it's this small ridge here for the trapezoid ligament. There's the groove for the subclavius muscle on the inferior border. Honestly, this is quite difficult to see even on real bones, but I guess theoretically it's there. And finally, you have a impression for the costoclavicular ligament on the sternal end on the inferior surface as well. Another interesting thing to think about is that this clavicle does not sit directly horizontal. It's not, if we're looking at a posterior view right now, it's not going to be directly horizontal. It's going to be at a slight angle. And that's because the acromion is just a little bit higher than the sternum. Now, another thing to think about is that when this clavicle is sitting on your sternum, this surface kind of sticks above the sternum. And that's because this is going to lift up a ton when you go into shoulder abduction. And so that leaves the room for this sternum to kind of move down and roll on the sternum. And that's actually what forms your jugular notch. So when you feel between your two clavicles and then you feel the top of your sternum, that's what you're feeling.